All right, everybody. It is September 27th, and today we are here with Matt Maddox, who from Wynn Resorts and Casinos. I think that's right. You'll correct me if I'm wrong on the official title. Kind of a really, I've had the pleasure of working with Matt throughout the pandemic, and really excited to have him with us today to tell us a bit about kind of who he is. Where was he at the start of this pandemic, and how he's been engaged throughout the course of it. So with that, let me just immediately turn over to Matt. Thank you so much for being here.
Great. So I've been with this company for about 20 years. We develop, large scale 4 and 5 million square foot, 5-star resorts. And, we're in the business of mass gathering. So that's what we do. We put 5,000 people in our nightclubs, all crammed together, doing what they do in there, and in our casinos and on our golf courses. And so, we're that's the business that we're in. What happened with me in particular and in this company was, if you go back in time 20 years, as my first job for this company, I moved to Macau as the first employee. To get our venture going over there in China. And this was in 2003. And what happened in 2003 in Macau and Hong Kong was SARS broke out. Now, being a 27-year-old kid with newly married in a foreign country, and all of a sudden everybody's wearing masks and you think you might die, was terrifying. And the death rate, as all of you know, from SARS back then was actually quite high. It was very lethal. And so I experienced firsthand what it was like to go into a lockdown, to be in a mask. Hong Kong was completely locked down. That's where we were living, trying to figure out how to get back to the United States and get out. And so it was a surreal experience. And luckily, it didn't really leave that region, but it was a really tough time for that region. Fast forward all the way to December 2019. And I'm talking to all my colleagues in China, and they are terrified of what's happening in Wuhan. And we have 15,000 employees over there, and we have thousands of employees with family members in that area that were talking about the devastation and the death that was occurring. And the people that are the executives at our company there were actually some of the same people that I worked with back in 2003 and 2004. And so what was interesting and really concerning for me was they were much more scared this time in December of 19 than they were of SARS in 2003. And this invisible killer was coming, and they all knew that it was going to be a really, really big problem. And it was spreading so fast, and it was so much more contagious than SARS. It was crystal clear that this was going to be a global problem. Now, the United States hadn't quite figured that out yet. We had the Super Bowl in January. Things are going great. But just our experience in China made me think this is going to be global, and it's going to be a real problem. And I don't know anything about it. So I started asking around to some of my friends and colleagues about who do you know or have experience with that could help educate me on what might be coming. And a mutual friend of Dr. Katz and mine, who's now in the Biden administration, introduced us. And, he had said, she's the best, you've got to talk to her. And this was probably in early March. It was before the shutdowns, right? And so we began talking, and I think after our first conversation, I just called her offline and said, hey, can I hire you as a consultant, please? Because here's what I know. Nobody knows what's going on. And in particular, in our industry, in our state, people are just dying, or not dying. They're craving information. They're craving unbiased information. They don't know what to believe or what not to believe. They just want facts. And so we began in March, almost every other day, 30-minute catch-up conversation, which was invaluable, because that allowed me to talk to our politicians and to our regulators, and actually set up a number of calls with our governor, with governor's chief of staff, and every week had all the chief medical officers from all of our hospitals on a phone call that I set up with Dr. Katz and her team to just talk about what they're seeing in Italy, what's going on in New York, what's going on in other places. And, people were just really wanting information. And so as it was becoming quite clear that COVID was spreading and was a real problem, talking to Dr. Katz, she became, a little bit of a mini celebrity with inside Las Vegas and our employees. We did a video together explaining, and you could Google it, find it, why it's good business for us to close. And we were the first to do that. We employ 10,000 people in Las Vegas and about 4,000 in Boston. And we closed before we were asked to by the state or by the governor or anyone else. People quickly followed, like literally days later. But when we did that, I asked Dr. Katz if she could record a video with me that I could send out to all 30,000 of our employees around the world so that they could hear why this makes good sense and why we don't know what's coming, but this is what we need to do right now to protect our business, ourselves, and our families. And so we did record that video. I'm sure you remember, and it went totally viral, at least viral in our industry. And one of the things that I decided at that point, this was mid-March of 2020, was that people are they're terrified. Again, our business is full of blue collar, line level, hardworking people, right? I mean, housekeepers and cleaners and engineers and dealers, and we have, of course, we have accounting and IT, and we have all of that stuff. But we have, we're largely a service-based industry. And so, I looked at our team and thought, and when we were talking to them, and actually Dr. Katz is on this video, and I did a lot of follow up with them all, is then it wasn't declared a pandemic, but a pandemic is coming. And what I need all of you to do is to stay home. That's your job. And I want you to stay home and think every day about what you can be doing for the community, what you can be doing for your family, and what you're not going to have to think about is your financial security. So as long as we're closed, we are going to pay every one of our team members their full salary, wages, and the tips they would have earned. That cost $250 million. And I think we were one of the only companies in America that did it. Shareholders were furious. And, I explained to them that, look, when there's an invisible lurking killer, and you tell a lot of people, hey, go home, you might die, and also you're now financially busted, you can't pay rent, because that was before all the relief efforts came in, before Congress did anything. It's like, that's untenable. That is just, you can't do that to people. And so we're going to invest in the culture. And I think it's going to pay off for our business, because there's one thing that's a fact, and I told my team this over and over again. Everybody that's alive today that's over the age of 10 will remember 2020. They will remember what happened. They will remember how they were treated, and they will remember who was good to them and who wasn't. Everybody will remember that. Most people, I don't even really know what happened in 2013 or pick the date, right? But 2020 is burned in all of our memories forever. And it's a real opportunity to walk the walk and to try to do the right thing and invest in the culture. It also had, from a pandemic response standpoint, a real benefit, because I knew that once we closed, we needed to figure out how to reopen. And I also knew if I furloughed everybody, trying to figure out how to reopen with 10 executives was no good. So we then had hundreds and hundreds and hundreds of people, from line level housekeepers to cleaners to dealers, all start thinking about their departments and how they personally could feel exposed, in groups or at lunches or their working environment. And so we began developing, literally 2 weeks after we closed in March, a reopening plan. We worked with Dr. Katz, and she brought in 2 people that were, infectious disease experts. And we put together a 27-page health guideline on how to reopen hotels and casinos. And when it was finished, this was like mid-April, which again, pretty early in the pandemic, right? Most everything shut down. When it was finished, I decided that, okay, everybody's still starved for information. And I don't know how right all of this is, but I do know that no one has put anything out yet in any industry. And we didn't just make it up. We did work with real health experts, and we tried to do the best we can, from air filtration to all the e-misting to all the ultralights to all the cleaning to all the plexi. I mean, Dr. Katz knows we went a little crazy, but intentionally, because I wanted people to feel safe if they're going to have to come back to work. And so I said, okay, it's done. Draft 1 is done. Post it. Put it out there. Just put it out, and let's get the incoming people saying, are you crazy? Why would you want to reopen? To that seems dangerous, to, oh, that's a bad idea. And it actually had the exact opposite effect, because everyone in industries that get people together started saying, oh, that's interesting. Let me look at it. So the NBA called and said, oh, this is really interesting. I'd like to take a look. Southwest Airlines CEOs like, hey, tell me about why you did this here. And all of a sudden there became a big conversation with executives from Disney, of course, in our industry, in sports leagues, all started looking at this paper, not because it was so brilliant. It was pretty good, but not because it was so brilliant, but because it was first. And that's kind of what I learned in this pandemic, is people just wanted unbiased information that was focused on solving something, not focused on explaining something. And so, that really also allowed our politicians and our regulators a roadmap. And they basically took our plan and put it in place, the Southern Nevada Health District, for everybody else. So some of our competitors called me like, you really went overboard on this. Do we really have to do all this stuff? Like, I didn't, I'm just telling you what we're doing. It came all the way down to, we built our own PCR testing lab here with the top of the line equipment, Thermo Fisher, Kingfisher equipment, staffed it. We can do 10,000 PCR tests a day. They're all pooled. It's saliva based. So that way, what I knew is getting employees back in the building, again, this was back in the summer of 2020, is the testing capacity wasn't up to speed in the state of Nevada. They were still just testing people. Really, back then, it was hard to get a test, that were sick. And I wanted to do surveillance testing to try to show that, to try to have a very safe environment, and to own if there was a COVID problem, and to be able to put it out immediately. And so we did that, and we started testing all of our employees every week. And then, as the year rolled on, and we did reopen in June, and people began coming back, we learned every day on what worked and what didn't. And then we started doing the testing for like all the athletics and schools in Las Vegas, because we had a facility that could just work and they loved it. And we were charging them, $10, which is a bargain. It's $100 cheaper than a normal PCR test. And it just covers our cost. So, having your own testing lab, being early and first, but most importantly, getting people that know a lot more than you and listening to them was really important for us. And I think it helped us move forward pretty quickly, but more importantly, safe, in a very safe way. And did we have COVID after we opened our place? Sure we did. We didn't have any major outbreaks in any single department. I think one of our call centers ended up having 5 cases at once. I'd say that was probably the worst of a spread. We had hundreds and hundreds of people out of thousands that probably contracted COVID here. But the thousands and thousands of employees that contracted COVID, they contracted it outside of here. And what it became, people would tell us all the time through surveys, the safest place they felt like they were going during the day was to work. They didn't feel, and that's in a casino, mind you, right? They didn't feel safe going into Home Depot or going into the restaurant or going into other places. So that was the environment we wanted to create. And I think it's just because we were so stringent on the safety cleaning issues, and we had this testing system in place. So you knew as you were looking around that within a week, everybody around you that were working there had been tested and had tested negative. Something else that we were able to do, just to backtrack a little bit, that I was proud of, by keeping everybody on board and trying to get the economy restarted. The health districts are probably across the country, but for sure in Nevada, are woefully understaffed. They weren't ready for what they were dealing with before COVID. And so when this hit, contact tracing to them was like, they didn't know what to do, how to do, and certainly didn't have the people to do it. So we took 110 of our call center agents that were just sitting at home and seconded them to the Southern Nevada Health District, and then trained them on how to do contact tracing. And so that actually really expedited the contact tracing effort for the state of Nevada, because they went from having 3 people to 113. And, all of a sudden that still wasn't enough, but it was enough to get the process going and to get people moving and thinking and trying to get ahead of all of this. So that was our early response days. I think in our industry, we were definitely the leaders in terms of the COVID response. And that was just out of necessity, because doing nothing or sitting back and waiting for other people to try to figure out what to do was not the right solution, because they didn't know. And it was better to just get the best people that we could and the smartest people that we could, and make our own decisions, and then help the hospitals and help the government and help the regulators with information that they needed, as opposed to waiting on them to tell us what to do. Because really, in government, there's a real need. A lot of times, a lot of those departments are understaffed, and they're looking for information, and they actually don't have the time or resources, in state government I'm talking about, to really dig into these issues. So our entire industry then sort of teamed up to help, to help the state get moving forward. So I have a few more things, then I can turn it over to questions. How long we've been going here? 20 minutes. And so, I think what gets kind of interesting is that was 2020. And as we all know, COVID comes in waves. And I would say the most amazing part was when COVID ended. I think everybody remembered that. COVID was over officially in July of 21, right? Everyone knew that it wasn't, but everyone acted like it was, right? The government said, take your masks off. There wasn't one state with a mask mandate anymore. I mean, it was just back on. Las Vegas was literally the roaring 20s. We could not keep up with the demand. The people coming in here were ready to go crazy, and they did. And it was fun, right? And it was, but quickly, I think the Delta variant reminded everyone, COVID's not over. And we were a little fast to jump to that conclusion. And so we went right back into that cycle of, we haven't been restricting, but we went back to mask mandates, because Las Vegas in particular had a flare up. We're now on the downside of that trend, and the hospitals have pretty much emptied out. But so we went back to mask, we went back to being more careful. We're still seeing here in Las Vegas, really strong business. People are still really, really, really excited to come and have a good time. Whether it's going to see, Marshmello or the Chainsmokers or Drake or Post Malone, we've got all those people playing here now, and it's a blast. And so people are having a really good time. What's also interesting is the places that were the most conservative, like Massachusetts, because they've had such a low positivity rate, and they've continued to not see this swell that the Southwest did and the South did. Interestingly, they don't have any restrictions. So Las Vegas, this place of party, you have to wear a mask if you're here, et cetera, et cetera. You go to Encore, Boston Harbor, Massachusetts, they still don't have, they're still on the, there aren't any restrictions or mask requirements. And it's really because I think for a variety of reasons, but one, they just don't have any, they didn't see the positivity rate jump through the roof. And they didn't see the hospitalizations, et cetera, et cetera, et cetera. So, on a state by state basis, each state has been interesting in the way that they've chosen to look at this and what they've chosen to do. And our job has just been to not be political and try to get information that is unbiased and right, and get it to the right people so that they can make the decisions. So, that was sort of the COVID journey in running casinos. And I don't know if there's anything else, Rebecca, you want me to?
Maybe one more thing to address before we wrap up this portion. Can you talk about what vaccination coverage is like amongst your employees now?
Sure. So we, again, I would say sort of a pat on the back, but we were pretty early in this. We opened the first public vaccination center in the state of Nevada. And here at Wynn, because we did a partnership with the hospital, on and on and on, but we opened the first one. And I would say it was before it was too political. It was pretty early, right? I mean, people wanted the vaccine. I mean, it was January, beginning of the year. And so we opened that, and we opened with, which seems normal now, but back then it wasn't so normal, get vaccinated or get tested every week, period, right? And if you want to stop doing the test every week, just get vaccinated. And so we have blue collar, extremely diverse workforce. And we got our vaccination rate in the hospitality business by May to 87% on 10,000 people. Now, up and down the strip, everybody else is stuck at 60 because, in my opinion, they waited too long. They didn't push the issue. And the longer you wait and you don't push something when it happens, the more entrenched people become about their beliefs, the more misinformation there is out there. And, next thing you know, it almost becomes mainstream right to not get a vaccination. It's gotten really weird and political. And so I think for us, getting ahead of it early in terms of information flow, providing on-site vaccination and on-site testing back in the first quarter allowed us to get to 87%, which I'm very proud of. And look, the final 13% are not going to do it unless they're 100% mandated. They're not going to do it. And for a lot of reasons that I don't understand, but they're just not going to. So that's where we are. And that 13% still needs to get a test every week, and they have to wear a mask. Everybody has to wear a mask now, but even going forward, that'll be the protocol up until, there's another change.
Well, Matt, I can't thank you enough for speaking with all of us today, but I've learned so much working with you during the pandemic. As you know, I've never actually been to Wynn or Encore Resorts. I'm hoping to change that soon and actually see these locations that we've talked about so much. Or I didn't realize how the creative thinking about using women with pool noodles to enforce a 6-foot distance in the pools. You asked a question, people were asking, like, can you poke a hole in your mask for your cigarette? Right. All sorts of things that never would have occurred to me that was something you'd have to think through. So it's been, I've truly enjoyed working with you, and we're so thankful for, it's just such a fascinating example of kind of what the private sector and the hospitality sector specifically can do for your employees and your community, and for this kind of public-private partnership. So for that, just wanted to thank you.